Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
When I think of dental disease, the first things I kind of think about are periodontal disease, so inflammation of the gums.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Chris. How are you doing today?
I'm great. How are you?
I'm doing all right. I wanted to give you a quick update this morning because I know people have been asking about my pug, Mac, because he has brachycephalic obstructive airway syndrome. And we did a show on that. So people are interested in that. They should go back and listen. But Mac had his elongated soft palate trimmed, and he had little wedges of his nose taken out so that he could breathe better. And just to let everybody know, he has his brand new nose is working fine. And now that the weather's cool, he's been really excited about going for walks. So there's my update. Mac had his surgery and things are already better for him.
His nip tuck. That's amazing. And yeah, thanks for updating the audience.
So today, Chris, we have a wonderful guest, our good friend, Dr. Beth Innis. And we've had Dr. Innis on the show before, and we both have worked at Dr. Innis's practice, the Sleepy Dog Veterinary Clinic. I met Dr. Beth a little over 3 years ago via Chris. So Chris had introduced us, and at the time, Chris, who was working there, was going on a 3-month trip and asked if I could, cover for her and see her patients while she was away. Well, he's only supposed to stay for 3 months, and that was 3 years ago. I just never left. I'm sure they've noticed, but no one has said anything. So I'm just going to keep. I'm just going to keep showing up. One of the things for me about working at Sleepy Dog is I'm proud to be there. Like, I'm proud that my work is appreciated. I'm proud that our clients are wonderful, and I'm proud to be associated or affiliated with Sleepy Dog Veterinary Clinic. And that makes me feel really good. So I enjoy being there, and hopefully they enjoy me being there. And since we've met, we've had a wonderful collaboration. And so we're going to talk with Dr. Beth today about one of her passions, which is maintaining good oral health for our dogs and cats. Just like humans, dogs and cats can develop a variety of dental issues, including gum disease, tooth decay, and plaque buildup. Dental disease can cause significant pain in our dogs and cats, even if they don't show it outwardly. And I think as owners, maybe we don't think about our pets' oral health, or maybe we don't think about the possibility of our pets having mouth pain. For instance, if we see our pet limping, it's something we can see. We recognize it as pain or injury. But if our pets are grumpy or lethargic or don't want to eat, maybe we don't put that together as dental disease or mouth pain. But dental disease, infections, abscesses, and cavities, they can all occur in our dogs and cats. And this can affect their eating habits, their mood, and their quality of life. I'm always interested, Chris, as I talk about it almost every episode, of the emotional lives of our animals. And we've discussed the definition of pain on other shows being not only an unpleasant sensory experience, but an emotional experience. So pain is a significant factor in our pet's quality of life. As a veterinary technician, I would say that pain is probably the number one concern of owners. Does my pet have pain? Are they suffering? So I'm interested to hear what Dr. Beth has to say about dental disease, oral hygiene, and how she performs these comprehensive dental examinations. And I'm also interested to hear about Dr. Beth's program, Miles of Smiles, that offers low-cost dentistries for rescues and shelter pets in need to facilitate their adoption and improve their quality of life. And what better way to start your new life with a nice set of clean, fresh teeth and no mouth pain, right? So it's a great start for them. Let me give you a little bit of background on Dr. Beth before we get started. Dr. Beth is the founder and owner of Sleepy Dog Veterinary Clinic. She's a licensed veterinarian certified in veterinary acupuncture, veterinary chiropractic, veterinary Chinese herbal medicine, and canine rehabilitation. And her dedication to continuing education keeps her in the forefront of veterinary advancements, ensuring that she can offer the best and latest treatments and technologies to her patients. At Sleepy Dog Veterinary Clinic, Dr. Innis strives to create a comfortable and stress-free environment, focusing on building lasting relationships with pet owners and their companions. And most importantly, she is a personal friend of mine and Chris's. So please welcome to the show, Dr. Bethany Innis.
Welcome, Dr. Beth.
Thanks for having me, guys. I'm so happy to be here, and I love all the work that you guys do. So I'm honored to be present with you.
Dr. Beth, why don't we jump right in and start with you telling our audience what is dental disease in pets? Why should we care about that?
It's a good question. It's definitely something that we veterinarians think of a lot in our everyday lives when we're doing our physical exams and beyond. When I think of dental disease, the first things I kind of think about are periodontal disease, so inflammation of the gums and decay of the teeth or breakdown of the teeth where they're situated in the bones of our mouth. And it can cause pain, a lot of pain. It can cause infection, can cause inflammation, all sorts of things that can be really subtle to pick up, as you were kind of starting to talk about a little bit in your intro, Kathy. And it is something that we can get an inkling of when we do our physical exam or when we hear a history of what's been going on at home from our people. But we don't really know the full story until the animal is sleepy and we're taking x-rays. So it's kind of a big span of things that gets us all the information that we need.
I hear you saying inflammation a lot, and I'm sure Chris's ears are ringing too, because as rehabbers, we're like, inflammation. As we've discussed before, inflammation has its place, but chronic inflammation can lead to a lot of problems.
And it can lead to problems in the mouth, as we're talking about, but it can also spread out into the body and it can affect other organ systems as well. And I think that, as you were also touching upon, it's really hard to go about your life if you have pain or inflammation happening in a part of your body and not be distracted by it. And I also think of it kind of, if you have a certain amount of energy in your body, if you're devoting a lot of energy to one area because it's inflamed or irritated or painful, then there's less to go around to the other places.
Dr. Beth, how does dental care at home fit into this equation? Are there things that are actually effective that our pet owners can do to help, as being a vital member of the team that cares for their own pet?
Absolutely. Yes. I think one of the first things I think of when you ask that question is when you are adopting a new pet or bringing a new pet into your home, seeing if you can get them used to the concept of toothbrushing. If you think of how our recommendations are to have brushing of our teeth twice daily, every day for our whole lives, and being seen by a dentist for a nice deep cleaning every 6 months. And when we look at the care that we provide for our pets, we can't really mimic that. It's just not totally reasonable and doable. But we can do our best to do daily brushing, which is probably the most effective thing that we can do dogs and cats need a different type of toothpaste because they're going to swallow it, not spit it out like we do. So you want to make sure that you have a pet friendly toothpaste, but brushing daily can make a huge difference. The other things that we can do at home are things like certain herbal supplements that can help provide probiotics or other things, other herbs that can help to prevent buildup and gingivitis. And there's also some water additives that can be helpful. But if there's one thing that you can do, I would say that one thing would be toothbrushing. The caveat being that not every animal is going to let us in there, and that's okay. So if you can't do it and you've tried, don't feel like a failure. Just give it a go. It can take a while to build up to an animal accepting that treatment at home too, but that's definitely the most bang for your buck.
It didn't take us long to be able to get Mac to allow me to brush his teeth. And I will say this, one of the factors that was helpful is that we have a fear-free groomer. And that was a huge help to us that she used a fear-free approach to getting him used to, getting his teeth brushed. So I know they're hard to find, but she was a really big factor in helping us get that going.
I agree with my Cavaliers when I get out the toothpaste, because you mentioned a pet-friendly toothpaste. It tastes good to them. So they think it's like a treat. And I'm like, time to brush your teeth. And they will actually give me their consent. They come over and they're calm. And they seem to enjoy, gobbling up that toothpaste while I'm actually scrubbing away.
They think it's a snack. Yeah.
Mm-hmm. Mm-hmm.
One thing that I usually recommend to my clients when they're starting a brushing program is to just get them hooked on the toothpaste first. And even if they're just taking it off the tip of your finger, so that we find a toothpaste that they really enjoy. And then once they're really hooked on that toothpaste, I have people start by putting it on the bristles of the toothbrush and have them just lick that off so they get used to the sensation of the bristles. And then once they're comfortable with the toothbrush and the toothpaste, then I have people start introducing it into their mouth. And usually we're focusing mostly on the upper and the outer teeth. That's what we can usually get to in a dog or cat. But yeah, if we do it slowly and make everything positive, then most animals will accept it. There are some that if they've had too much pain or they've had some experience that was really negative having to do with their mouth, it might feel more invasive and it could take longer. But yeah, a lot of animals can accept it pretty readily.
We're talking about a toothbrush. I've also seen the kind of bristles that you can put on your finger. Is that also effective? And would that be more appropriate for smaller mouths or cats?
I think it could be. I think whatever works for you and the animal is going to be the best choice. I think one thing that I usually recommend is like a toddler toothbrush, because they're pretty little and easy to maneuver and they're nice and soft. So that's a nice place to start. Some people do really well with that fingertip toothbrush. It looks kind of like a thimble, and the bristles on it are a little bit different. So some animals don't like the feel of that, but I think it's great to experiment and do what works for you the best. Either one of those is great.
I also heard that, like for my own dogs, I'll kind of pull their cheek away, get it in there by their molars, and then close their mouth, because then that relaxes the cheek and provides more room. So that's a little trick that I've incorporated.
We know that regular dental checkups and cleanings can prevent serious dental disease in pets, but you mentioned that dental disease can affect other organs in the body. And so can you talk a little bit about how dental disease might be a contributing factor to things like heart disease or kidney disease?
So I think there's a couple different things that I think of when I think of how these things in the mouth can affect other organ systems. And one is that inflammation that we were talking about. So the inflammatory cascade is going to affect all sorts of things. So different little chemicals that our body releases when it's inflamed can trickle down into other organ systems. If you have a high load of bacteria in your mouth, which we know happens with dental disease and plaque and tartar, then those things can also travel to other parts of the body. If you've had an animal that has had heart disease, or if you have some kind of heart disease and you go to the dentist, sometimes we'll use antibiotics if there's a concern about having some bacteria end up in the heart and the valves of the heart. Sometimes we worry about the inflammation and bacterial load getting to the liver or the kidneys. And I've seen all sorts of things, including one of my own dogs where she was getting recurrent urinary tract infections that once we got her teeth sorted out, those resolved. So I can't explain that like in a step-by-step way of how that happened with her. But I do know that even a lot of my patients that are a little bit older and rickety and have some joint problems, their joints feel better after they've had their teeth cleaned because their body just isn't fighting so much inflammation and probably some level of infection. I don't have all the answers in terms of how this happens and what timeline it can happen on. I would say that it happens over and over again. And it's something that we can at least help prevent or stave off with regular dental care.
I work with this particular surgeon. And at the time we were doing mostly like CCL repairs and stuff like that. But clients would always say, well, can you follow up my dog's CCL procedure with a dentistry? And that surgeon would always go, no, absolutely not. We're not going to do this to the body. We're not going to release all this bacteria into your dog's body while they're recovering from CCL surgery. And I'd never put that together, but I was like, you know what, that makes sense. We probably should not do that at the same time. It should probably be a separate procedure. Yeah.
It's really difficult because we have to use anesthesia to do a deep cleaning for these mouths and take our x-rays. So we want to do everything that we can at the same time to reduce the amount of time that the animal has to go through anesthesia. But it's true, things like mass removals and spay and neuters, a lot of people want to do it at the same time, but it is tricky, especially if you're in a joint, like it sounds like your surgeon was, then it's extra intimidating to want to release all that bacteria into the body. Absolutely.
So for the pet owners listening out there, what are some of the early signs that they may be able to pick up on at home that indicates that their pet may be having some problems?
Well, usually I tell people that any change in behavior you want to note and bring to your veterinarian because it could be something early on in the process. Things that I usually wonder about the most are any changes in appetite, but even more so, I would say any changes in chewing. So sometimes people will notice that an animal will chew on one side of their mouth more than the other, or I'd say this might happen more with cats than with dogs, but can affect both. Sometimes the animals will become more messy in their eating, and you'll notice like that there's more food debris around the bowls, or they can't get all of the morsels from the bowls. If they're on a dry food, then they may have trouble actually crunching the food, and they might prefer the gravy or the soft food for that reason. The other things that I notice or ask about would be any pawing or rubbing at the face that's new, or any drooling. Sometimes if an animal has a tooth that's bothering them, they'll create more drool in their mouth, or you might notice more staining of that kind of rust colored reddish stain that sometimes happens from animal saliva on their chin more. But really any kind of change in behavior makes me wonder and want to do a physical exam.
What about bad breath?
Definitely. I mean, this is something that we hear about all the time. I tend to notice it most when I'm driving in my car with my pets, and I can tell the state of their dental health by what the car smells like and how quickly I need to put down the window. But yes, absolutely bad breath. And it can mount. So sometimes it can happen over time. And so it's kind of interesting to ask people or to think about in your own family, like, gosh, how long have I noticed this? And how long has it been since I've been to the veterinarian?
How often should our pets have a professional dental cleaning? And does the frequency vary by species or breed? I feel like I see a lot of pugs for dentistries because of their crowded little mouths. Is there a propensity in certain breeds for dental disease? And can we avoid professional dentistries with routine brushing?
Yes, I'm going to answer those three questions.
All of my questions.
Let me know if I miss one. I will start with, so yes, I think we can often avoid cleanings. We can't always avoid all of them, but we can at least have to do less in their lives with brushing at home. So it's definitely well worth it to make that part of your routine if that's possible. There are some breeds, yes, that require more of the general anesthesia cleanings. And those are often dogs with very small mouths where there's a lot of overcrowding of the teeth. Sometimes they'll even be like in our little pugs and Frenchies, they'll be kind of shifted around into different locations. And so that can lead to further trouble of buildup in different places. And it's hard to get those areas clean. There are certainly, though, many large breed dogs and medium-sized breed dogs that also need cleanings. Sometimes it depends on their diet. Sometimes no matter what you do, it's just the luck of the draw. With certain animals, they get dealt a better hand with their mouths than others. In terms of how often to do a cleaning, I think it varies. The best thing to do is have your animal checked once or twice a year by your veterinarian, or if anything comes up, and they can give a recommendation. But there are some animals that in an ideal world, we would clean their teeth every 6 months, and that would be like almost enough. And then there are other animals that can go years between cleanings. But definitely the more preventative care that we do and the more early we do the cleanings, the less tooth loss we're going to have later on and the less pain.
Dr. Beth, it seems like we're talking a lot about dogs and so forth, but we've also mentioned cats. I must say that for most of my life, I never thought about a dentistry for cats, and I've had cats throughout my life. So this may be a surprise for a lot of our listeners. Can you expound on why cats also need cleanings, and is the frequency as often as it is for dogs? How do they compare and contrast?
Cats definitely need dental care as well. And many of them are willing to have their teeth brushed too. So that all of this applies to cats as well. So I'm glad you asked that. In terms of frequency of cleanings, I would say same thing as our dog friends in that it can vary widely. They may need dental care more frequently if they have certain conditions in their mouth. And I can expand on that a little bit if you'd like. It can depend on their diet, especially if they were rescued from somewhere and had some rough times in their past. They may have more propensity to develop some inflammation and build up earlier that may or may not be able to be kind of solved with good food and good care once they get to us. But they also need it. Cats are known for, even more than dogs, hiding any discomfort or anything going on with them. So we really have to look deeply. I see many cats for dentistries that have come in with absolutely no symptoms of any troubles. And then we clean their teeth, perhaps remove any disease in whatever way, or treat whatever disease is going on in their mouth. And then the next time we see them, the person will note that they have more energy, or their appetite is improved, or they seem younger, or something like that, because they have been struggling with that inflammation and that bacterial load for the whole time. We just didn't know it until we have addressed the problem.
Cats that have diseases like FIV or FELV, their body's already busy sort of trying to fight some other disease. And I think that they're at higher risk sometimes for things like lesions in the mouth and pain in the mouth and ulcerations, and even just getting them checked routinely every year can lead to finding another problem that we can help them with. Do they have a foreign body in their mouth? Do they have lesions in their mouth? Do they have tumors in their mouth?
Absolutely. And with diseases like feline leukemia and FIV, their body is immunosuppressed. So they're not able to keep up with that like constant onslaught of bacterial invasion or inflammation. And so I think it's an extra reason to pay attention to that. But also they're going to be less likely to be able to fight things off. So they're going to be even more affected by it. One thing I would say with cats is we see something called resorptive lesions with them, which are these incredibly painful lesions for them. They often don't tell us what's going on in any way symptom wise. But when we get in there and take x-rays, we see that the tooth is actually dissolving in their mouth. And it's really, really painful when they're under anesthesia, even though they're completely sleeping. If we touch it in the right spot, they'll chatter their teeth because it's so painful as a reflex. So that's something that we don't know until we look, and can make a huge impact in their quality of life to get that treated.
Before with dogs, we mentioned certain breeds and such, and Kathy, your pug being brachycephalic. I think it's worth mentioning that there are also cats that are brachycephalic. And so do those breeds have more issues as well? Because oftentimes when we think of cats, we think of a general, skull shape and that their mouths would be similar. They're not quite as dysmorphic as dogs. But is that true that your Persians, et cetera, would have more issues?
I think that's probably true. I can't speak to that in terms of numbers like I can with dogs because I see less of the brachycephalic breeds in general in my practice. And that's, I think, mostly because I see domestic short hair types. It's the same kind of issue in that there's less space in the mouth for those teeth. And then I also think of it as those smushy faces make it so that their teeth are really bumping right up against their sinuses. And so there's just like not a lot of room for things to go wrong. In small dogs, we can see things like if you have a tooth root abscess, it can actually present on the surface of their face. In cats, it can be, I think it causes maybe more pain and pressure than we can see. But there's just not that much room for error.
You've also mentioned diet a few times. I initially was thinking type of food. In other words, hard kibble versus soft. But you're actually talking about nutrition when you were saying like, maybe a poor diet because they were living in hard times previously. Can you expand on that? And does a hard kibble actually, is it more effective in keeping teeth healthier?
I think this is something that's debated because I'm in the alternative medicine field. We worry that when we use the more processed hard kibbles, that it can affect the body and promote inflammation because of that, it's kind of like a heating kind of property that comes with that processing, which would be worse for the teeth. Conventional medicine, we've always said that a hard kibble is going to be better because there's going to be crunching, and that's going to do some mechanical abrasing of the surface and get rid of some of that tartar. There are also prescription diets out there that are effective in a lot of cats in particular that are like very large pieces of kibble that have like a kind of an oily coat that helps to break down some of that tartar. I feel like for the most part, I would rather have my patients on a really high quality canned or fresh or freeze dried food and have people brushing their teeth than to use the kibble, because I think that the kibble might have deleterious effects on the whole body, but that's argued. And from my perspective, I always tell my clients if there was one right way to feed an animal, we would all be doing it. And so we have to make adjustments for what our priorities are in that particular animal. I will also say that if you have an animal that has not a lot of teeth or has had pain in their mouth or dental disease, crunching on those foods might be harder for them. So they might not eat as well. So I'm always going to lean a little bit more in the canned direction. For cats, we know pretty much that canned food is better for them in general because of the water content. They tend to need a little assistance getting as much water in their bodies as possible, and they can have a lot less problems with urinary disease and kidney disease later. So we tend to go that way. I think that there could be a case made for like having a diet made of a softer food that's super high quality, low sugars, because we don't want the sugars to hang out on the top of the teeth and create more plaque and tartar. And then do some crunchy treats and some, if we need some kind of prescription kibbles for some, then maybe that could be our happy medium.
And what about those periodontal chews? How do you feel about those?
I feel pretty good about those. The Veterinary Dental Society has a page. I can send you guys the link, people. It's called the VOHC. And they have a list of products that are approved by the veterinary dentists. It's a pretty extensive list. And it has like some funny things that are like a little bit more shocking than others about what's approved in terms of like, I think there's one like Whimsies is one that I think we see in a lot of like the nice pet stores, but there's also Greenies on here as well. So, they're seeing that those things do seem to be helpful in general for pets. I think that my favorites are probably one by CET called Veggie Dents, which are nice, and they're a nice crunchy one. And it doesn't have a lot of the things that can promote allergies, and a lot of my allergy sufferers. So I like those for that reason. Some people like the rawhide based ones. Other people do not like the rawhide based ones. So that's also controversial. I think that the other thing is there are some things that are approved in general by veterinarians that the dentists do not like. Some things like bananas and sweet potatoes can be actually like a little bit hard on the teeth because they're sticky and they can have those sugars stick around longer. They're also not big fans of bones because they can actually do damage to the teeth in terms of breaking the teeth. So it's always a balance. Something can be good for one part of the body and challenging for another part of the body. So we just kind of have to do our balancing act and do our best.
I'm glad you mentioned about the breaking of the teeth, because I think now when you shop, even in the toy section for your pets, they have kind of grades, for senior dogs, for puppies, for hard chewers. And, I know we're talking about dentistry, but I do think that's something worth mentioning, because a lot of those toys are marketed as, helping with oral hygiene and tooth care and all of that kind of stuff. But it needs to be matched with your pet and their ability to chew and the health of their mouth.
And your pet's behavior too, because I'm thinking of some dogs in my own life who would chew until their gums are bleeding because they love to chew so much, but it's not necessarily the best thing for their mouth. So you have to tailor to what feels good to your dog's mind and body. So yeah, I think it's very, very personalized. But I would say when in doubt, go back to, if I can brush my animal's teeth, I brush my animal's teeth, and that's the best thing you can do for them.
Do you think we could pivot here, Dr. Beth, and maybe you could describe and tell us, what does a dentistry look like? When I drop Mac off for the day for his dental, what does that look like for him?
I would love to tell you about that. And as an aside, I made a video about this. So part of the reason I wanted to make that was because it's so hard to picture what's happening. And I think that the scariest thing for people and us is that in order to do these cleanings and to take these x-rays, is we have to put them under anesthesia. And so a lot of things go into that, including a lot of time, some extra tests, and a lot of financial commitment. And so that's something that is like a real hurdle for people. But in order to make sure that your animal is ready for the anesthesia, we're going to want to do things like pre-anesthetic blood work. So we get a blood sample and we look and see what the state of things look like in those kidneys and in the liver and all over the body. If they have enough red blood cells and white blood cells, and if we see any reason that we need to adjust our medicines that we're going to give them or do anything differently. So we usually do that either a couple weeks before, or sometimes if we think everything is going to look great that day, we'll do it the morning of. The other thing that we do in order to get them ready for the procedure is we'll often give them a little bit of a calming medicine the night before and the morning of. And we find that's helpful for two reasons. One is that it's not so stressful for them. And we're doing that more and more in veterinary medicine to just try to have everything be as positive and stress-free as possible. But we also use it because we can sometimes get ahead of any discomfort that we may cause if we have to do any more aggressive treatments. And also it'll sometimes reduce the amount of anesthetics that we need to use. So we're going to do everything we can to use the least amount possible. So once all those things are taken care of, then at Sleepy Dog, we keep our patients for the day. We have our patients come in the morning. They usually have had a little less breakfast than usual, but not none. The current thinking is that we can have a little bit in our stomach and we actually recover a little bit better than in the old days where we would have everyone fast the night before. So we just have them come in with a little bit. And then when we're ready to go, I do a physical exam, make sure nothing has changed and there's no reason that I don't want to go ahead with the procedure. If that looks good, then we'll give them a little bit of what we call pre-medicine, which is something that makes them sleepy and calm, but not all the way asleep. Once that's kind of kicked in, which takes about maybe 15 or 20 minutes for most pets, then we'll place an intravenous catheter so that we always have venous access in case we need to give any medicine that we need to get into the body rapidly, but also so they can have fluids throughout their procedure go into their veins. And that's to keep them nice and hydrated. It also helps to kind of flush out the anesthetics once we are done with our anesthetics. If anyone has any kidney stresses or liver stresses or any other body stresses, it also helps with that as well. So once we have our IV in, then we usually give them a medicine called an induction agent, and that makes them sleepy enough that we can place an endotracheal tube, so that tube that goes down their trachea so that they can breathe and get lots of oxygen and our anesthetic gas into them. So we put that in, then we get them all hooked up to monitoring equipments. So we measure during the whole procedure. We'll watch their heart rate. We will watch how much oxygen they have in their body, how much carbon dioxide is coming out of their body, what their blood pressure is like, what their temperature is like. And there's a whole person that is devoted to just watching those things during our whole procedure. And that person is trained in what is normal and what is not normal. So we keep a very close eye on all those things. Then once we have all our monitoring equipment on, then we start with some x-rays, and we take x-rays of every single tooth in the mouth and every single place there should be a tooth in the mouth. So sometimes if an animal has lost teeth in the past or has had teeth extracted, we still want to look at that area and make sure that everything's healed up and there's nothing we need to do to address that area. Once those are completed, then we'll do our probing and assessing of like, what do things look physically from the outside other than just the x-rays. And so we look for any things like chipped or fractured teeth, any areas of inflammation, any tumors in the mouth, any pockets between the teeth and the gums, any signs of infection. And we have a little map where we take all our notes, and then I take that and I look at my x-rays and I decide if there's anything that I need to do about any teeth in particular. In animals, we remove teeth more, I think, than they do in people medicine, because one, we see a lot more disease, I believe, because we don't get all the cleanings that people get. And also the ability to do all of the follow-up care is going to be different in our animals. If we do need to do anything that is extensive in terms of an extraction or like deep treatments, something like putting a certain like kind of antibiotic gel under the gum line or something like that, where we're really probing deeply, then we'll use a local anesthetic. So our version of a Novocaine block. And we can do that so that all 4 areas of the mouth, both like the right and left, upper and lower teeth and gums, can be numbed. And I do that pretty liberally because sometimes even just the cleanings can be irritating. So I do a lot of local anesthesia, and that also makes it so that anything that we need to do that is uncomfortable for them, we still can get away with not using as much anesthetic gas as we would use if we had to do something like an abdominal surgery. And we use lots of other pain medicines along our way and anti-inflammatories. Then we do a nice cleaning of the teeth. We scale them and then we polish them. We often put some not the same as a sealant for people, but a similar thing, a coating on top of their teeth to do further protection. At my practice, I also do some cold laser after I take out any teeth to make sure that I help to promote healing and also reduce inflammation that I've caused by probing around in there. And then I also do a chiropractic adjustment because I'm moving the patient from their back to their front, to their side, maybe to their other side. And I just want to be mindful of their spine and make sure they wake up feeling good. And then once we're all done, then we turn off our anesthetic gas and we let our patient come back to consciousness, and we watch them like little hawk mothers as they come back, and then we get everything ready for them to go home. At my clinic, we send home a whole bag of tricks, everything from some homeopathic anti-inflammatories and some psyllium in case there's any changes in their bowel movements. Either it's too hard to go or there's too much flow from their bowels. We'll use psyllium to dial that up and dial that down, and some preventative care things usually herbally and any kind of conventional pain medicines that I feel like we need to make sure that once those local anesthetics wear off, they feel good.
You've covered the entire body, Dr. Beth. You've really covered, but I love that. I love that you're doing a chiropractic adjustment after, and I hadn't thought of that because I thought you were going to say I'll do some acupuncture points, but you're right. The manipulation of these dogs into different positions or cats into different positions during the procedure it's a lot. It's a lot of maneuvering. So I like that you're treating the body as a whole.
And we do acupuncture I have trained my veterinary nurses to put in acupuncture points in 3 or 4 of their feet. And those points are helpful. One of them is called the master point for the head and neck. And that's really good for mouth and neck pain. So we use that. And then we use a point in their ankles that's really good for pain in general, also called the aspirin point. So just trying to get ahead of things. There's some knowledge that using acupuncture can reduce the amount of anesthetics that you need as well. So I'm just always trying to use all my different tricks to use the least amount of obnoxious things that I need to.
I also love the fact that you mentioned laser. Many veterinarians are using laser post-operatively for things like spay neuters and other procedures, but I'm not sure many think to use it after oral surgery and procedures. The sponsor for Petability is the Medcovet Luma, which is a red light therapy device that you can use at home, very similar to laser. And I know I've been contacted personally about treating the absorption that you mentioned earlier, Dr. Beth, and, other ailments. It really targets inflammation. And when we're talking about all the inflammation that can be in the mouth, I think that it could really be part of people's regular care of their pets is using, something like that at home as well.
I definitely think so. I think the other thing that it might be nice to add that into the protocol would be the TMJ, the temporomandibular joint, because I notice a lot when I'm doing my chiropractic adjustments, when I'm treating an animal that has any teeth problems, that is often really tight. And that's something that I notice when we've resolved the tooth problems, or at least made them better, it can loosen up a little bit. And I imagine also it just is going to go down the cervical spine as well. But I definitely think that the laser is great for the mouth in general, the tissues in there, but also not forgetting the TMJ, because that's definitely affected.
Well, Dr. Beth, I want to sing your praises because you've done 2 dentistries on my Cavaliers and the outcomes have been fantastic. Despite my best efforts to brush their teeth, I use a supplement called Perio Support faithfully with meals twice a day. Last dental, Baxter, who's 8, had 20 teeth come out, and Julep had 8. And I think it surprised us both, right, Dr. Beth? Because, to our point, until you get in there, you don't know. You literally said Baxter's teeth were just hanging there. I could tell their recovery was great, and his gusto for life and eating and so forth changed remarkably within days after the procedure. So he was painful, but I didn't recognize it. And I like to think I'm somewhat of a professional.
But you are. And that's something that I hear over and over. And it's hard to hear because I see everyone is doing their best and they're really trying. And it's just kind of like this disease that we're a little bit in battle with all the time. And I know you brush their teeth well, and I know how good they are for it. It's just something that I think is like some animals' Achilles heel. And it happens so slowly that we don't know how advanced it is until we get in there. And I think we as veterinarians also, we're trying not to, anesthetize everyone so frequently if we can help it. And so, it's just kind of walking a tightrope sometimes. The goal is to make it as easy on their bodies, the whole procedure, so that we can do it as frequently as we need to, but also, keep in mind that life is life and we can only do what we can only do.
Well, and hearing all that you do, before, during, and after certainly justifies the cost. I know that some people, don't want to pay for dentals. Mm-hmm. They don't think they're necessary. And I hope after listening to this episode, people realize the importance of proper dental care for their pets. And if you don't take care of their teeth, you may end up paying for it in other ways, down the line. And do you think that it can contribute to longevity in pets and, just better overall all health and prevent some of these other, problems down the road? For example, my Cavaliers have heart disease. And so, like you said, we're always trying to balance, when to do the dentistries and, not tax their heart. But what you pointed out to me was I need to do the dentistries because they have heart disease.
Right. It's so tricky. I think that there is probably a connection with longevity, especially when we make decisions about how long our pets can live based on their quality of life. So if they are painful or they're distracted or they're reclusive because they have pain in their mouth, then it's definitely going to affect that. And yes, absolutely, it's going to affect their other organs, including their musculoskeletal system. So I think another thing that I would add would be incorporating dentistry into my practice is that I saw a lot of patients who were elders, because that's usually the guys that I see, who came in who had mouths full of dental disease. We had postponed or eliminated the option of a dental cleaning because of their age or some other condition. And then I was seeing them for acupuncture, and then they would live for like 2 or 3 more years. And I was just really sad about not having gone in there earlier. And so I think that a real passion of mine is to not wait, even though it might be hard, because an animal may have some other conditions that we're working with. If we wait too long, it's only going to get worse. And hopefully we'll have them living as long as possible. And so we'll have better years with not so much pain and disease.
Are there times that you need to refer these patients out for more intensive procedures, for example, oral surgery?
Yes. So just like our veterinary orthopedic surgeons or neurologists or ophthalmologists, there are specialists in veterinary dentistry. We're lucky here in the Boston area. We have Angel Memorial, who has a veterinary dentistry team. And then there's also veterinary dental associates in Boxborough, Massachusetts. And those are all boarded dental specialists. They are really great for things like if there are teeth that we're trying to save and preserve. For instance, if we have like a working dog, that it's really, really important that their mouth has all the original teeth and that there's no spaces or anything like that. Or if it's an animal that the owner is really passionate and willing to do something like a root canal or a crown or something like that, that's where they would go, would be to a veterinary dentist. There's also things that can be a little bit more advanced in terms of surgery, but also sometimes if we have an animal that has a very tiny little head and their canine teeth, those fang teeth that come out that we think of as the fangs, if they're diseased and the bone that's holding it in is compromised in some way, then we might want to have a specialist do something like that. Or if there's a procedure that's going to take a very long time for a generalist like me, but would have, the dentist could do it in a quicker way so that they could tend to like all the teeth in the mouth, then that might be another reason why we would send them. And then some clients prefer to have the specialist do everything, and that's also fine. It's just scheduling and a financial commitment that otherwise some people are not able to do.
Certainly dentistry in pets has come a long way over the years. Mm-hmm. There's all kinds of special procedures and specialists. What kind of extra training did you do to be able to perform the dentistries in your practice?
Well, in veterinary school, we learned some dentistry, and depending on if it's something that you do on a daily or weekly basis in your practice, a lot of people will end up taking further training in it. That can be anywhere from like continuing education, lectures to also, in this case, like a lot of like wet lab type things to actually learn how to do these surgical procedures, because the extractions really are surgery. And we do a lot of suturing of gums and things like that. But for me, I wanted a little bit more of an intensive program. So I chose one through a group called the International Veterinary Dental Institute, that its whole mission is to train general practitioners like myself on general dentistries so that we can be more comfortable with it, we can be more skilled, and more patients can be treated. And so that's the group that I do my training with. And I've been doing that for probably, I guess, over a year now. But I don't really want to stop, because it's like, just when you think you know enough, of course, there's something else to learn.
So it seems like, based on the importance of dentistry, that all animals with teeth should really take care of their mouths. I remember I had the privilege of traveling to Africa, and I was in Kenya, and there's something called Giraffe Manor. It's very famous, and you stay at this inn, and the giraffes come over and stick their head in the windows of the hotel and share breakfast with you and so forth. And Betty, a matriarch giraffe, had such bad breath. And so I actually pointed it out to the owner, and he was really appreciative that I brought that up to him, and he was going to look into it and see if they could do some sort of, dentistry procedure for Betty. And then I've also seen, where they're training like the hippopotamus to open its mouth in the zoo to get these giant toothbrushes in there and scrub their teeth and so forth. So it really covers, I think, a vast array of animals, and not just our domestic pets. So glad we had you on the show. This has been needed for a very, very long time.
Yes. Thank you, Dr. Beth.
You.
I think this is such an important topic. And when I was going through my hospice and palliative care certification, that they had an entire workshop on this, and the possibility of patients who are in the end stage of their life having mouth pain, and how we need to consider that as part of their overall treatment. And maybe we can't do a dentistry who's on a patient who's at the, maybe end stage or last 6 months of their life, but there are things that we can do to make them more comfortable. And we should not discount the possibility of mouth pain. If you've ever had mouth pain, then or tooth pain, then it can be significant. As we're wrapping up, can you just tell us a little bit more about the Miles of Smiles program? And if anybody wants to donate to the Miles of Smiles program, where can they find you and how can they do that?
Sure. So the Miles of Smiles program is a charitable initiative that we started at Sleepy Dog to try to help foster and rescue animals be easier to adopt. It's really, really important to have animals go into a new home with everything kind of starting fresh. I see a lot of cats through this program, and because a lot of these cats have had tough times on the streets and their mouths are a little bit shaky starting out, if we can get all of their disease treated and have them be comfortable, they're just going to go into a home much more easily, be adopted more easily, and have a better fit, I think, a lot of times. The other kind of interesting, fun part about it is because often they've already been placed in a home in our program, and they're either have already been adopted or they're going to be adopted by a family. The family can see the before and after of the pet is like. I think that's a great thing in terms of client education and education for all of us in how important dental care is. So they tend to take things even more seriously going forward, which is awesome. If you'd like to donate to our program, you can go to our website, which is www.sleepydog.vet. So you can just click on Miles of Smiles, and then on that page, there is a way to donate and help some shelter pets in need. There is one friend that we are doing a fundraiser for now named Forklift, who are trying to get on the schedule. And so there should be some things on our social media, but maybe I could send you that too, Kathy and Chris.
Oh, that would be wonderful. Yes.
Spread the word.
Yeah. I would do that. Yeah. Forklift. Oh my gosh. How cute is that?
I think Forklift came in with Bulldozer.
That makes sense. Of course.
Which was awesome.
That makes sense.
Go to our homepage. There is a video that you can click on that says, "What is a COHAT? Learn more in this video by Dr. Beth." And a COHAT just means a comprehensive oral health assessment and treatment. And so we are doing a demonstration of what it looks like to do a dentistry in our clinic. So that could be helpful.
I think that's a great resource for our listeners. So thank you for engaging in your charitable efforts.
Yeah, it's a real pleasure. And I love seeing the cats come through because they're always very patient with us. And it's a real pleasure to work with them.
It's a great way to start a new life for these animals. Thanks, Dr. Beth. It was always great to talk with you. And I will probably see you soon. I'm going to keep coming back every week.
I love it. I don't want you to stop. So that's great.
Thank you. Bye.
All right. Thank you, guys. Have a good rest of the day.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.